non-alcoholic fatty liver disease, insulin resistance, and ceramides. My name is Isabela Cornejo, and today I'm going to talk about this.
Condition in clinical practice, it affects about 20% of the world population. We care about fatty liver disease because it is one of the problems which can cause liver failure, liver cancer, and the need for liver transplantation. The presence of extra fat in the liver can cause chronic irritation of the liver cells and subsequently can cause further liver damage. There are three common causes of fatty liver disease, being overweight, patients with diabetes, and also patients with high cholesterol. Keeping in mind, some people with normal body weight can have fatty liver disease. The increasing epidemic of fatty liver disease has been recently attributed to overweight and the high prevalence of diabetes. Fatty liver disease used to be a very rare condition in children. However, recently, with the increasing problem of obesity in children, fatty liver disease become affecting about 10% of children. Early in the course of the disease, many patients have no symptoms. However, when the scarring and the inflammation of the liver progress, many patients start to complain of problems related to enlargement of the liver or fatigue. If complications happen from fatty liver disease, such as cirrhosis or complete scarring, patient can have problems with bleeding and symptoms of other complications of liver disease, such as liver cancer. When we do a blood test for a patient with fatty liver disease, many patients will have elevated liver function test. Imaging modalities can be very helpful for diagnosis of fatty liver disease, such as ultrasound, CT scan, MRI, or fibroscan. Occasionally, patients might need liver biopsy to assess the significance of the damage in their liver. Fatty liver disease in early stage could be completely reversible. However, if patients continue to have excess fat in their liver, this can lead to complete scarring of the liver, or what we call cirrhosis, and subsequently liver failure and its complications, such as liver cancer and the need for liver transplantations. Fatty liver disease become a more common indication for liver transplantation globally. There is no specific treatment for fatty liver disease. The most important step is to control the risk factors for liver disease, such as high cholesterol and controlling the blood sugar, and lose weight for obese individuals. There are recent studies which confirm clearly the benefit of coffee for patients with liver disease. There have been some suggestions that drinking 2 or 3 cups of coffee a day will prevent liver cancer and liver scarring in patients with fatty liver disease. The most important food to avoid for patients with fatty liver disease are food rich in refined sugars, such as bread, rice, potatoes, and corn. Also, we recommend for patients to consume lean meat and increase the amount of vegetables and salads in their diet. At Johns Hopkins Hospital, we are conducting several clinical trials looking for a novel therapy for fatty liver disease. We are using tablets form for specific drugs which alter the pathophysiology of fatty liver disease. What we are hoping is to prevent the accumulation of fat in the liver, to reduce the amount of scarring in the liver from fatty liver disease, and eventually preventing liver cancer and liver failure.
Non-alcoholic fatty liver disease is a buildup of extra fat in liver cells that is not caused by alcohol. It is normal for the liver to contain some fat. However, if more than 5 to 10% of the liver's weight is fat, then it's called a fatty liver.
Alcohol can still develop liver problems, serious ones. Non-alcoholic fatty liver disease affects some 80 million people in the United States. That's a big number. Here to tell us about it, Dr. Robert Brown, Medical Director of the Transplantation Initiative at Columbia University College of Physicians and Surgeons. It's a long title of a school. Dr. Brown, thanks for coming in. First of all, for people out here who haven't heard much about it, what is fatty liver disease?
Well, most people think of liver disease as a problem just in people who drink alcohol or do other bad things to themselves. But non-alcoholic fatty liver disease is a condition where fat accumulates in the liver, and then the liver becomes inflamed and even scarred, all the way to cirrhosis without alcohol or any of those other known
So no
toxins.
alcohol, but are there behavioral elements that contribute to it?
Yes, it's most common in patients who are either obese or diabetic, but we have a proportion of patients who are not overweight who still seem to have this, and there are probably genetic factors as well. We see it in higher rates, for example, in the Hispanic community.
In terms of, and I read that upward of 70% of people who have type 2 diabetes can develop this, is that right?
Yeah, almost everyone who is diabetic will have some degree of fat in their liver, and a good proportion can go on to develop this NASH, this more serious form that can go on to develop advanced liver problems.
Okay, so what are some of the symptoms we're talking about here?
Unfortunately, NASH is a silent epidemic. We don't see any symptoms until the liver disease is more advanced. So people need to really talk to their doctors, and if they're at risk, get some simple blood tests to see if it might be a problem.
Right, in terms of behavioral day-to-day, if someone hasn't been diagnosed with this but has type 2 or thinks they might be sort of in harm's way, what are some of the things they can do to maybe try to prevent their body from developing it?
Well, I think we all need to live and eat healthier. We need to eat less. We need to eat a better diet. We need to increase our exercise, stay thin, and if you have diabetes, obviously meet with your doctor and keep that in good control.
But now, 80 million people is a huge number, and probably there are some people who die from related issues with this. Why is it something we haven't seen more of? Just because of the stigma with liver disease, everyone assumes it's because of alcoholism?
Yeah, I think there are elements of stigma. There's also elements that we don't look until it's advanced, and only a small proportion of the 80 million people will go on to develop a liver problem. But as you said, 80 million is a big number, and a small proportion of a big number is going to be a large number of people who are going to have this as a problem in the future. And obesity, as you know, is increasing at quite a clip. The number of obese children, for example, has tripled in the last decade.
All right, Dr. Brown, important issue. We appreciate you coming in studio today.
Oh, thanks for having me.
Thank you very much.
Insulin resistance is when cells in your muscles, body fat, and liver start resisting or ignoring the signal that the hormone insulin is trying to send out, which is to grab glucose off the bloodstream and put it into your cells.
It's $1 million question. I wish I could explain the exact cause of insulin resistance, but unfortunately no one can say for sure. Of course, there are many things that we do know, although the exact process and timeline of the development of insulin resistance is still uncertain. What are things that we know? Genetics play a role in this, okay? Genetics play a role in this, and even more concerning, probably something called epigenetics plays a role in this. And that means that we have genes, maybe possibly all of us have the genes to develop insulin resistance, but those genes get turned on in some people, but not in everyone. And factors such as what was the environment when a mother was pregnant probably play a big role in this. So again, genetics, definitely a big factor. Number two on this is what you were exposed to as a child as well. So in other words, it's very interesting, but beta cells of the pancreas, which are the cells that produce insulin, are a lot like the cells of the brain, meaning that they develop a lot when we are younger and then they stop developing. We're not growing new beta cells, just like we're not growing new brain cells when someone is older. That's all happening in childhood. And if in childhood someone is exposed to a lot of sugar, processed carbohydrates, young in life, what can happen to those beta cells is that they can hypertrophy, meaning they get bigger. And if your beta cells are bigger, even later in life, if you eat the exact same carbohydrates as someone who didn't have this problem, who has normal beta cell size, you're going to throw out more insulin. And so again, the higher levels of insulin around actually themselves, it is thought, are the key to creating that insulin resistance. Of course, again, with genetics playing a role. So genetics, early childhood exposures probably play a big role. And again, diet in early childhood is a big deal there. But again, even if you didn't have childhood exposures, if you're eating a lot of refined carbohydrates and once again increasing the insulin in general, that high level of insulin itself can be toxic to the beta cells. So it's probably not one of those answers. It's probably a combination. But again, once you have it, what can you do? Decrease and deal with the cause of it, not trying to band-aid it just with medication. Deal with the insulin resistance by allowing your body to need less insulin.
Yeah, the million-dollar question.
Yeah, yeah.
Right.
Ceramides are lipid species that exert biological effects through cellular proliferation, differentiation, and cell death, and interact with several pathways involved in insulin resistance, oxidative stress, inflammation, and apoptosis, all of which are linked to NAFLD.
Ceramides. Now, ceramides, there are many different kinds of ceramides, but it appears to be a very important part of the waterproofing of the skin. In individuals that have, say, eczema, there may be a defective protein called filaggrin, which then translates to the barrier effect and the lipids not being normal. So, given that, it is realize that if you supply the skin with some of these ceramides, that you can maybe salvage the situation, that many of these ceramides can be then taken into the cells and then extruded and make better mortar to keep in the water more effectively. So it's a very important sort of step forward in learning that barrier function is critically important, and that maybe there is this medicine, as it were, these topicals that can help replace the deficiency in ceramides. So they're very important advance, probably in terms of moisturizing and barrier repair.
Pros. A recent study by Chaurasia et al. Established the importance of ceramides through the genetic manipulation of dihydroxyceramide desaturase in mice, and inducible whole-body dilation of DEX in both lean and obese mice altered energy balance, reduced body weight and adiposity, and brought about the attendant metabolic benefits, decreased hepatic steatosis and increased insulin sensitivity and glucose tolerance. In sum, dilation of DEX1 improved insulin signaling and mitochondrial function and decreased lipogenesis and lipid uptake. cons. However, these findings do not establish the necessity of ceramides for the development of insulin resistance. Multiple studies in rodents and humans have disassociated hepatic ceramide content from changes in hepatic insulin sensitivity. Insulin resistance probably encompasses heterogeneous subtypes with discrete mechanisms, but it is most clinical situations in ultimately reflect ectopic lipid accumulation in insulin-responsive organs. In some patients, concurrent increases in intracellular ceramides may impair mitochondrial function and exacerbate lipid accumulation and insulin resistance. Modest weight loss can be effective in many scenarios, but it is not difficult to achieve and sustain without using meal replacement medication or bariatric surgery. These findings are consistent with those of previous studies that support the development of experimental medications that enhance hepatic mitochondrial oxidation, possible by reducing ceramide biosynthesis.
To fatty liver disease, non-alcoholic fatty liver disease, specifically using the expertise that we've developed over the last several decades, understanding glucose transporter biology. So this is an exciting new project that came out of initial studies related to HIV therapies. We were working on an off-target effect of the drugs that were being used, the HIV protease inhibitors. And after having success in helping to remove that off-target effect, we've now turned that on in the other direction and are intentionally targeting glucose transport molecules, and specifically to address the nutrient sensing mechanisms that are present within the liver. We recognized that these molecules are fundamentally important, and there are many circumstances where we can take advantage of the function of these proteins to our advantage. We focused on fatty liver disease because we think that has the greatest unmet need, the greatest market potential, but there are certainly a number of other applications that can come out of the work that we're doing. Fatty liver disease is incredibly important. It affects about a quarter of the world population, and there currently is no specifically marketed drug to address that problem. And it's a major problem that is unrecognized. Many patients are walking around with fatty liver disease and they don't even recognize that they have that. And the risk of having other problems related to that, cardiovascular disease and diabetes, most importantly, in addition to the progression of the fatty liver disease to the later stages, leading to liver failures. I've been incredibly impressed by the Harrington Discovery Institute in this whole process. Being in academia, it's a very steep learning curve to understand what are the needs, how does a pharmaceutical company look at drug development, and being able to bridge that gap from the academic perspective is very important, and it really is accelerating our project tremendously. I'm very excited because of the level of engagement. It's providing much more support than I anticipated when I first applied for this award. The financial resources are important, but I think the expertise that the Harrington Discovery Institute provides and the level of engagement, it's very specific, it's tailored to our needs, and giving me a perspective well beyond what I currently have.